You can eat these 7 foods every day and still need glasses. That may sound like a strange way to begin a video about healthy eating, but it is where we need to start. Food does not reduce myopia, remove astigmatism, or dissolve a cataract. What the right foods can do is provide the retina, the lens, and the surface of the eye with nutrients they need to function normally. Today, I will not simply give you a list of healthy vitamins. I will explain what the eye actually receives from each food, where the real benefits end, and where attractive advertising begins. At the center of this story are 3 names that may sound complicated: lutein, zeaxanthin, and omega-3. Lutein and zeaxanthin are natural pigments. They accumulate in the macula, the central area of the retina that allows us to read, recognize faces, and see fine detail. There, they form part of the eye's own antioxidant defense and help absorb some high-energy light. Omega-3 is a group of fatty acids. One of them, DHA, is a structural component of retinal cell membranes. This is why nutrition really is connected to eye health, but not in the sense of eat one food and see more clearly. It works through consistent, long-term support of the tissues. The first food is spinach. Its main advantage for the eyes is its high lutein and zeaxanthin content. These substances are not merely located somewhere near the eye. They are actually present in the retina and the lens. That is why green leafy vegetables appear so often in recommendations for eye health. There is one important detail. Lutein and zeaxanthin are fat-soluble carotenoids, so spinach should not always be eaten as a lonely pile of leaves. A small amount of vegetable oil, some nuts, or an egg alongside it can make the meal more complete. But do not expect the letters on an eye chart to become sharper after 1 week. Spinach supports eye tissues, but it does not change the shape of the eyeball and cannot replace glasses. The second food is the egg, or more precisely, the egg yolk. Many people think an egg is useful only because of its protein, but the nutrients that are most interesting for the eyes are found in the yolk. It contains lutein and zeaxanthin. The amount may be lower than in a large serving of greens, but the fat in the yolk helps make these pigments readily available to the body. This is a good example of why the value of food depends not only on the amount of a nutrient written on paper, but also on how well the body can absorb it. An egg is easy to add to a normal breakfast, but the rule, the more the better, does not apply. If a person has dietary restrictions, a lipid disorder, or specific advice from a treating doctor, the diet should be planned individually. The third food is fatty fish, such as salmon, sardines, mackerel, or trout. Here, the main nutrient is not lutein, but omega-3, particularly DHA and EPA. DHA is present in high concentrations in the retina and is an important part of its cell membranes. This is one reason fish is considered a valuable part of a balanced diet. But we should not turn this fact into a promise of treatment. Large studies did not show that adding omega-3 capsules to the special AREDS2 formula provided an extra benefit in stopping age-related macular degeneration. Omega-3 should not be viewed as a universal treatment for dry eye either. Fish is a healthy part of the diet, not a substitute for diagnosis, eye drops, or medical treatment when those are genuinely needed. The fourth food is nuts. Almonds and hazelnuts are valued as sources of vitamin E, which contributes to the antioxidant protection of cells. Walnuts also contain a plant form of omega-3 called alpha-linolenic acid. There is a detail here that advertising often leaves out. The body converts plant-based omega-3 into DHA and EPA only in small amounts. A walnut is therefore useful, but it is not a complete equivalent of fatty fish. A small portion of unsalted nuts makes a convenient snack. A huge bag of heavily salted, roasted nuts eaten in front of the television is a different matter, because a great deal of salt and calories can arrive unnoticed along with the beneficial nutrients. Naturally, people with a nut allergy must avoid them. The fifth food is the orange. Its main value in this list is vitamin C. Vitamin C acts as an antioxidant and helps the body synthesize collagen, which is needed by many tissues, including structures of the eye and blood vessel walls. However, the phrase vitamin C is good for the eyes does not mean that an orange can clear a cloudy lens or restore vision damaged by retinal disease. Research on individual antioxidants has produced mixed results, and the proven AREDS2 treatment formula is intended only for certain stages of age-related macular degeneration. It is not prescribed to everyone. For everyday nutrition, it is usually wiser to choose a whole orange rather than a sweet juice. That way, a person also receives fiber and does not drink the equivalent of several fruits in a single minute. The sixth food is red sweet pepper. Yes, ordinary red bell pepper and not necessarily a hot pepper. It is rich in vitamin C, and its red color also indicates the presence of plant pigments called carotenoids. In terms of vitamin C, red bell pepper can be even more interesting than the familiar orange. This is a good example of why an eye-healthy diet should not be built around one main food. Some people do not like citrus fruits, and others cannot tolerate them. Peppers, broccoli, berries, and other vegetables can provide the same important nutrients from different sources. Red pepper can be eaten fresh or included in normal meals. What matters is regularity and variety, not the search for one perfect recipe. The seventh place belongs to other dark green vegetables and herbs, including broccoli, kale, Swiss chard, and parsley. We mentioned spinach separately because it is especially well known as a source of lutein and zeaxanthin. But if you force yourself to eat spinach every single day, the healthy habit may quickly become tiring. Different green vegetables provide carotenoids, vitamin C, provitamin A, and other nutrients in different combinations. Variety is what makes a diet sustainable. Today it may be broccoli, tomorrow a green salad, and the next day herbs added to a familiar dish. The eye does not demand a fashionable superfood. It needs a normal, varied diet that a person can maintain for months and years. Now, let us put the whole picture together. Spinach and other green vegetables provide lutein and zeaxanthin. Egg yolk provides the same pigments in a form that is convenient for absorption. Fatty fish provides DHA and EPA. Nuts add vitamin E and plant-based omega-3. Oranges and red peppers help provide vitamin C. But none of these foods works alone as a medicine. More importantly, the benefit does not come from checking 7 boxes in a single day. It comes from the overall pattern of eating. If a person eats spinach while the rest of the diet consists of sugary drinks and highly processed foods, one salad will not cancel out everything else. In practice, this can be very simple. Breakfast may include an egg with herbs. Lunch can include a salad with red pepper and a small amount of oil. Several times during the week, fish can replace another heavily processed meat product. A small amount of unsalted nuts and a whole fruit can serve as a snack. There is no need to calculate every molecule of lutein. Healthy eating works best when it becomes a normal part of life, not a 10-day challenge. People often ask whether these foods are better fresh, cooked, or frozen. There is no single universal answer. Some vitamin C is sensitive to prolonged heating, so it is useful to keep fresh sweet pepper and fruit in the diet. But that does not make cooked vegetables useless. Gentle cooking breaks down the firm walls of plant cells and can make some carotenoids easier to access. Frozen spinach or broccoli also remains normal food, especially if it helps green vegetables appear on the table regularly. It is far more important not to argue about the one correct cooking method, not to boil vegetables for hours, and not to cover them with a large amount of heavy sauce. There is also an opposite trap. People may begin to fear every food that did not make the top 7. In reality, berries, legumes, carrots, pumpkin, whole grains, and many other foods also contribute to general health. This is not a ranking in which 8th place suddenly becomes useless. It is a convenient way to understand different groups of nutrients. The more varied a normal diet is, the less likely it is to depend on one vitamin and one dramatic promise. Another common mistake is to hear the names of these nutrients and immediately go shopping for supplements. Food and capsules do not follow the same logic. The special AREDS2 formula can indeed slow the progression of age-related macular degeneration in some patients at particular stages of the disease. But it does not prevent the disease in every healthy person, treat cataracts, or improve a glasses prescription. Older formulas containing beta-carotene are especially unsuitable for current and former smokers because they increase the risk of lung cancer. Vitamins marketed for the eyes should therefore not be chosen by the brightest packaging. First, we need to know whether there is a real medical indication. Most importantly, even an ideal diet does not replace an eye examination. If straight lines begin to look wavy, a spot appears in the center of the image, vision noticeably decreases, or you develop flashes, many new floaters, pain, or severe redness, there is no reason to wait for spinach or fish to work. This is no longer a question of a healthy menu, it is a reason to identify the cause. Nutrition works slowly and provides support. Diagnosis answers a different question. What is happening to the eye right now? So my choice as a doctor is not one most useful food, but a combination of 7 accessible groups: spinach, eggs, fatty fish, nuts, oranges, red sweet pepper, and other dark green vegetables. They provide the eyes with lutein, zeaxanthin, omega-3, and vitamins C and E without promising the impossible. If you want to know whether ordinary food is enough in your situation, whether you need supplements, or whether changes in your vision are unrelated to vitamins, you can find out calmly during an examination at Ko'z Nuri. First, an accurate diagnosis, then a precise recommendation. For your eyes, that is far more useful than believing in one miracle food.